Welcome back to the CannMed Coffee Talk Lounge here at CannMed 2022. I'm here with Bonni Goldstein. She is our medicine keynote presenter here at CannMed. Bonni, welcome to the CannMed Coffee Talk Lounge.
Thank you for having me.
It's great to see you in person again.
It is so nice to be back in person. It's been a long 2.5 years, and it's just great to see everybody here.
Yeah, and so in particular, coming to an event like CannMed and being here in person, what is it that you're looking to get out of the event?
Well, you know, we haven't really had a huge amount of education over the last 2.5 years because we've all been home. Yeah. And so I'm really excited to see my fellow cannabis scientists and hear what they have to say that they've learned over the last 2 years, their latest publications, where the cultivation side is going, where the medical side is going, and just looking really to get more information.
Yeah, and to that point, are there any presentations in particular that you're excited to hear?
Well, I'm always excited to hear Dr. Ethan Rousseau. He's like our medical cannabis guru, and he's doing a talk on the latest in for cannabis and psychiatry. So I'm really excited about that.
Yeah, I spoke with him a little earlier today, and I'm looking forward to that one too. It's great to have a full hour of Ethan. I think it's a treat for everyone. So you're participating in the medical practicum, you're giving a keynote presentation as we mentioned, and you're participating on a panel. So thank you very much for everything that you do for CannMed. So tell us a bit about what you're going to be presenting about in your keynote, though. I know it's about pediatrics specifically.
That's right. So I'm focusing on two conditions that are very commonly treated now with cannabis. So one, epilepsy, and certainly we're seeing great results. And I'm very excited because there's a ton of new research that just came out in the last couple of years, because this is still new. Mm-hmm. And now we're finally getting some long-term results. So I'll be talking about that. And then also with autism, I'm going to be talking about some research that I've done where we published 2 papers in the last 6 months looking at biomarkers collected in the saliva that help document the impact that medical cannabis is having on children with autism.
Yeah, no, it's good that you mentioned that. You know, epilepsy, that's sort of, that's pretty well established, right, in terms of using cannabis for epilepsy. But autism, that's one that's really starting to gain steam. So it's great that you have this data now that's showing the biomarkers, so you can really quantify that and really show that.
That's right. And what we're finding is that the biomarker improvements correlate with what the parents are reporting. So it's no longer anecdotal report. We now have objective data, which, really we don't have for pharmaceuticals. Nobody's doing that. So I would say that this actually puts cannabis on an even playing field with pharmaceuticals to treat autism.
Excellent. So let me speak a bit about the panel that you're going to be on as well. What are the goals there?
So I think with the panel, I'm going to be sitting with other clinicians, and we're just going to share our collective experience treating thousands of patients with medical cannabis. And what's interesting is that we all come from different parts of the country, and we're all working in our practices, and we're all finding very similar results for people with dementia, for people with chronic pain, for people with anxiety, depression, that cannabis is this unbelievable and useful tool for doctors to start incorporating. Really, you can't be a doctor anymore and ignore the endocannabinoid system. You have to understand that this plays a major role in human health, and that by not offering cannabis as an option to patients, especially to those who are not finding good results with conventional treatments, you're doing a disservice.
Yeah. No, and I think it's important too that even if physicians aren't going to necessarily be recommending it, to at least be knowledgeable enough that if your patient comes to you with questions, that you can answer them.
Right. You want to have a conversation. And this idea of there's not enough research. Well, one could say that, but I just had to race through a presentation because there is so much research that I wanted to share. And again, it's not a panacea for everything. This is just another tool in the toolbox of that physicians and other healthcare practitioners should be including in their practice.
Yeah, and one encouraging sign that I noticed when I was sitting in on the practicum a little bit earlier is when Eloise was welcoming everyone, she asked people to raise their hand if this was their first experience getting medical cannabis education, and a good amount of people raised their hands.
Yeah, absolutely. When you're sitting in a room and a patient asks you about something and you don't know about it, and then that happens over and over again. As a scientist, right? Doctors are trained scientists. We should know about this so that we at least can have a conversation with our patients that's meaningful to them so that we can help them. And again, not everybody should be taking cannabis, but at the same time, you want to be able to be discriminating in those, when you have these conversations with patients, who might it help? Who might it not help? That's what you are there to do with your patients, is to help them sort out all of this scientific data.
Yeah, absolutely. And one thing that you mentioned too was all the research. And, one thing that we find, especially, with the prohibitions on cannabis, there's only so much research that can be done. And a lot of it has to be done by these private companies, much like, Canformatics and the study that you had talked about earlier. So with that said, how important is it for these companies that as they're getting new data to come to events like CannMed and share that? Because, obviously they are privately funded companies. They are putting up their own money, and they might want to withhold that. But, it is important to share.
Absolutely. And, there's a statistic that says that something published in the scientific data takes 17 years to trickle down to the clinician.
Right.
That's a long time. Yeah. So conferences like this are so important because, one, there's camaraderie and all of that, but at the same time, we're all learning about what other people are doing in this very important field of cannabis medicine. Absolutely.
All right, Bonni, I know that you're busy, as we mentioned, with your many responsibilities here at CannMed, but I appreciate you taking the time to talk with us, and have a great event.
Thanks so much, Ben.